Well, hey, greetings, folks. This is Gabriel Timmons here with GC Financial. You see, I have my new shirt eligible for Medicare. Most of you know me from the ACA space, but for the last couple of years, I've been working in the Medicare space, helping people. So I just want to let you know I am in the Medicare space. I got a mentor. I partnered up with Miss Gwen Wright, phenomenal young lady. She's been a phenomenal asset to me as I was learning the Medicare space. A lot simple, a lot easier than the ACA space because there's not that many changes. But she's been in the insurance industry for over 30 years. She helps people all over the country. She really knows the Medicare space very well. She's been a blessing to me, and she's in the Spartanburg area. I know somewhere up there in that area up there in the Clemson lane there, but has a heart, biggest state of Texas. Miss Gwen Wright, the floor is yours.
Okay, good evening, Gabriel. Thank you for that introduction. Today, we'll be discussing, we know we are approaching the annual enrollment period for Medicare. And at that time, we know that everyone that has Medicare is eligible to change plans. So what we want to do today is kind of get people, make them a little bit more knowledgeable about Medicare. So when they choosing or looking at plans, that they'll have a better understanding of how to choose a plan, one that'll work for them all of 2026. So that's what we'll be covering today. Okay, so what we're getting ready to do now, we're going to do a Medicare 101 to give you some good general information about the Medicare program. Okay, first starting, who can get Medicare? Who can get Medicare? U.S. citizens and legal residents. They must live in the U.S. for at least 5 years in a row, including the 5 years just before applying for Medicare. So you also must meet one of the following requirements. You must be a U.S. citizen or U.S. resident for 5 years. And as far as age, is age 65 or older. If you're younger than 65, you have to have a qualifying disability. And then lastly, any age with a diagnosis of end-stage renal disease or ALS. So those are the requirements to be eligible for Medicare. Can you have both Medicare and Medicaid? And the answer is yes. Some people are eligible for both Medicare and Medicaid, and that's considered dual eligibility. We call that population dual eligibles. Medicare and Medicaid can work together and may cover some of all your health care costs. So if you have a disability or a medical condition, you may qualify for special Medicare plans, and those are what we call special needs plans. So next, do I need Medicare if I plan to work past 65? So we know in this day and time, a lot of individuals, they're not retiring at age 65. They're continuing to work past 65. So your Medicare enrollment options when working past 65, they may be different. So, a lot of times I get phone calls that say, well, I'm turning 65 in October. So my question would be, are you working and do you plan to continue to work? So if they plan to continue to work, they may be able to delay getting their Medicare. So generally, you can delay Medicare past age 65 without a penalty in certain situations. And the first being the employer has 20 or more employees. The employer's health coverage is considered credible. You need to enroll at age 65. Your employer has fewer than 20 employees, and your coverage is not considered credible. So sometimes individuals have insurance, and they'll say, well, I have insurance on my job, but it has to be what deemed credible coverage. So what if I'm covered by my spouse's employer? So you may be able to delay if your employer-based health coverage is through your spouse. You may have to enroll if it depends on the spouse's employer and any rules the employer has around covered dependents. So that's for individuals that's continuing, they're turning 65, they're not retiring, they're continuing to work. And getting Medicare while still working Medicare and your employer insurance can work together. So it is individuals that's continuing to work, but they did choose to start their Medicare benefits. So Medicare and employer insurance coverage can be coordinated. So if you take any part of Medicare, you will no longer be able to contribute to a health savings account. Medicare will not cover anyone but you. So consider how any dependents will be covered. So if a person has a coverage through their employer, they can have family members covered through their employees. But with Medicare, it's individual coverage. So what does Medicare cover? Original Medicare covers parts A and B. Original Medicare has the two parts. Part A is the hospital insurance. It helps pay for hospital and inpatient care. Part B, that's medical insurance. It helps pay for the doctor and the outpatient care. Part A, hospital insurance. We'll talk a little bit about that. Medicare Part A covers hospital stays and inpatient care, and that includes your hospital room and meals, care in special units such as intensive care, prescription drugs and medical supplies used during an inpatient stay, lab tests, x-rays, and medical equipment as an inpatient. The operating room and recovery room services. It also covers the skilled nursing services. It covers some blood transfusions, hospice care, including the medications to manage symptoms and pain, part-time skilled care for the homebound after a qualified inpatient stay, and rehabilitation services after a qualified inpatient hospital stay. So all those benefits are covered under Part A, which is also known as hospital insurance. Part A, fast facts, premium free if you or your spouse worked and paid taxes for 10 years or longer. So the average individual does not pay a premium for Part A. It's premium free. The next is it can't be denied coverage. If you have Part A, you can't be denied coverage. Coverage is nationwide, including any qualified hospital in the U.S. So if a person has that Medicare card, they can take it to any hospital in the U.S. The coverage and costs are per benefit period. They must be admitted as an inpatient, not on observation status for it to be covered under Part A. And lastly, it provides 60 lifetime reserve days. So that's a little bit of information about Medicare Part A, the hospital insurance. Now we'll look at Medicare Part B, the medical insurance. So Medicare Part B covers doctor's visits and outpatient care, and that includes doctor visits, including when you are in the hospital, an annual wellness visit and preventive services like flu shots, clinical laboratory services like blood and urine tests. It covers x-rays, MRIs, CT scans, EKGs, and some other diagnostic tests. Some health programs like smoking cessation and obesity counseling. Also, physical therapy, occupational therapy, and speech language pathology services. It covers diabetes screenings, education, and certain supplies. Mental health care is covered under Part B. Durable medical equipment for use at home, like wheelchairs and walkers. Ambulatory surgery centers, services, ambulance, and emergency room services. Also, telehealth visits are not for use in emergencies, and not all providers offer the virtual care. So that's the Part B, the medical insurance. Here's some fast facts about Part B. Is like Part A is premium free. However, Part B, on the most part, is not. for the average individual. That's a monthly premium, and it's adjusted for income. The coverage can't be denied. Coverage is nationwide, including any provider who accepts Medicare. The premium penalty for late enrollment. So if an individual doesn't enroll in Part B when they're first eligible, they are subject to a premium penalty for late enrollment unless they qualify for a special enrollment period. So that's the Medicare Part B, which covers the medical expenses. There are some things that Medicare does not cover. Original Medicare, Parts A and B, does not cover. Here's a list. All of the cost of your care. So there's a co-insurance with Medicare. 80%, Medicare pays 80%. You're responsible for the 20%. You have out-of-pocket costs with no limits. And if you have Medicare Advantage plans, you have what they call a maximum out-of-pocket that would cap those expenses. But with original Medicare, there's no limit. Next is the prescription drugs. It has prescription drug coverage. It does not cover that. So you have to get that under a private insurance company. Your Part B or your drug coverage is not included in original Medicare. Next is the routine dental's not included. Vision or hearing care is not included. Eyeglasses, contacts, or hearing aids not included in original Medicare. Long-term or custodial care like help bathing, eating, dressing. That's not included. Excess charges for services by doctors who don't accept Medicare assignment. You'll be responsible for those charges. Care received outside the U.S. except for certain circumstances. So this is a list of some of the things that Medicare does not cover, original Medicare. However, Medicare Advantage, you can get these benefits included in your plan. So where can I get more coverage? Options for coverage. Okay, we have an option 1, and then we have option 2. Option 1, add one or both of the following to original Medicare. So we just went over Medicare. We know that it has 2 parts. Part A is the hospital. Part B is the medical. So at this point, we don't have any drug coverage, and then we have that 20% cost share that we're responsible for. So option 1, add one or both to your original Medicare. The first one, you want to add the Medicare Part D plan, and that's offered by a private insurance company, and it helps pay for prescription drugs. So remember, original Medicare doesn't cover drugs, but you can get what they call a prescription drug plan that helps pay for the prescription drugs. And the second thing with option 1 that you may want to add, you have the original Medicare that covers your hospital and medical, and you still have that 20% co-insurance that you're responsible for. So to cover that 20%, you have the option of getting a Medicare supplement insurance, also known as Medigap. And that's also offered by private insurance companies. And this helps pay some or all of the out-of-pocket costs not paid by original Medicare. So you can get, and those Medicare supplement plans are standardized, okay? So options for coverage again, option 1 is you keep your original Medicare that covers your hospital and covers your medical services. Then you can add a standalone, what we call a drug plan to that coverage because you'll need that drug coverage. And then to cover your out-of-pocket costs, you have the option of a Medicare supplement or a Medigap plan. So that's option 1, okay? Option 2, you can choose a Medicare Advantage plan. Medicare Advantage is also known as Medicare Part C, and these plans are offered by private insurance companies. Part C, it combines your Part A, your Part B, and most times your Part D. And it also has additional benefits. Some of the benefits that were on the list that Medicare doesn't cover, those benefits are included in the Medicare Advantage plan. They offer what Medicare covers plus extra benefits. And these are through a private insurance company. You're getting all your benefits from one plan. Part C again combines Part A, hospital insurance, and Part B, the medical insurance, in one plan. Part D usually includes prescription drug coverage, and it may offer additional benefits. And they also have a Medicare Advantage plans that does not have the Part D, and they're called just Medicare Advantage. And those are for individuals that have other drug coverage, which a good example would be for veterans. So they wouldn't need that Part D component. So you do have Medicare Advantage plans where you can get the extra benefits like the dental, vision, hearing, transportation, gym membership. And if you don't need the Part B, then you would still be able to enjoy the Medicare Advantage plan. Medicare Part C is a Medicare Advantage again, the option 2, an alternative to original Medicare Parts A and B. So this is a choice that you have. You'll still be in the Medicare program, but your benefits would be administered through the Medicare Advantage plan. Plan members are still in the Medicare program. Benefits are administered by the plan. Plans are offered by private insurance companies. All the commercials that you see are running on TV. Those are the private insurance company that offer Medicare Advantage plans and some the Medicare supplement. Most plans offer built-in prescription drug coverage, and plans also offer additional health benefits such as dental, vision, and fitness. All Medicare Advantage plans cover all benefits of Part A except hospice care, which is still covered by Part A. All the benefits of Part B. Most Medicare Advantage plans cover prescription drugs. Medicare Advantage plans may also offer additional benefits and features such as dental exams, cleanings, and x-rays, eye exams, eyeglasses and contact lenses, hearing tests and hearing aids, fitness programs, and memberships. So these are plans, they're designed to give you additional benefits and then save you money as well by having it all in one plan. Coordinated care. Part C plans offer, whereas original Medicare, they really just pay the cost of your medical expenses. The difference is the Part C plans are what they call coordinated care plans. Those type plans, you have the Health Maintenance Organization Plan, known as the HMO. You have point of service plans, the POS, the Preferred Provider Organization plans. You have the PPOs, the special needs plans. Then you have dual special needs plans. These plans are for individuals that have Medicare and Medicaid. They have dual coverage. Then you have the chronic special needs plans. These are for individuals with a qualifying chronic condition. And then you have the institutional special needs plans. These are for individuals that's in an institution like a nursing home or skilled nursing. Then you have the institutional equivalent special needs plans. So you have several different types of plans that meet the needs of the individuals, depending on what their needs are. Okay, other plan types, you have the private fee-for-service plans, and then lastly, you have the medical savings account plans. So these are the different types of Medicare Advantage plans. And again, they're designed to meet specific needs of the individuals. Fast facts about Medicare Advantage or Medicare Part C. You must be enrolled in both Medicare Part A and Part B and live in the plan service area. You can't be denied coverage based on current financial or health status, including pre-existing conditions. You may be required to use provider and pharmacy networks. A lot of the plans are network-based. Coverage and costs vary by plan and may change each year. So the plans, they're for a calendar year, starting January 1st, and it'll run to the December 1st. So that's a calendar year. Annual limit on out-of-pocket costs for Medicare covered services. So they have what this feature called the maximum out-of-pocket, where with original Medicare, the cost was unlimited, doesn't have a cap, but every Medicare Advantage plan has to have that maximum out-of-pocket. And then they may charge a monthly plan premium in addition to your Part B premium. Remember, we said that there's a premium most of the time for Part B. So with the Medicare Advantage plan, depending on the plan, you could have a monthly plan premium for the Medicare Advantage plan in addition to your Medicare Part B premium. And then lastly, you must continue to pay the Part B premium to Medicare. Part D covers prescription drugs. Medicare Part D insurance provides coverage for prescription drugs and some vaccines. There's two ways to get the coverage. The first one is the standalone Part D plan. Individuals that have original Medicare, they usually get their drug benefits through the standalone. They purchase a drug plan to go along with the original Medicare. Because remember, original Medicare only covers Part A and Part B, hospital and medical. There's no drug coverage with original Medicare. So most of those individuals get their drug coverage through a standalone Part D plan. And also a Medicare Advantage plan that includes prescription drug coverage. So the way to get your Part D benefits or your prescription drug coverage, you can buy a standalone or a prescription drug plan. But if you enroll in that Medicare Advantage plan or that Medicare Part C, most of the time the drug coverage is included in the plan. Medicare Part D plans cover types of drugs most commonly prescribed for Medicare beneficiaries as determined by federal standards. Specific brand name drugs and generic drugs included on the drug list, and that's called a formulary. And then lastly, commercially available vaccines not covered by Part B. So these are some of the things that the Part D covers. Formulary, that's a list of prescription drugs covered by a plan. So every plan doesn't cover all the drugs. They have drugs that they include in their that they'll cover, and that's called their formulary. And the formularies are tiered. They're tiered formularies. Drugs are grouped into tiers based on cost. In general, the lower the tier, the lower the cost. And there are also deductibles that may be charged by tier. Okay, the standard structure is you have 5 tiers. Tier 1 is the preferred generic. Tier 2 is a generic. Tier 3 is a brand drug. And that's the preferred brand. Tier 4 is the non-preferred brand. And tier 5 is the specialty. So the higher the tier, the higher the cost of or the out-of-pocket cost of copay or coinsurance. So during the year, you may go through different drug coverage stages with the Part D. So it's stages, okay? So first stage is that annual deductible stage. So at this stage, you pay for your drugs until you reach your plan's deductible. So if your plan doesn't have a deductible, your coverage starts with the first prescription that you fill. The initial coverage is the next phase. If you have a deductible, once you meet the deductible, then you move into the initial coverage stage. You pay a copay or coinsurance, and your plan pays the rest. And you stay in this stage. Once you and others on your behalf have paid a combined total of $2,000. So once you pay $2,000, and then you move into what they call the catastrophic coverage stage, and that's the last stage. So once you move into the catastrophic coverage stage, you pay nothing out of pocket for your Medicare covered Part D drugs. You stay in this stage for the rest of the plan year. So that's kind of like a maximum out of pocket for the Part D. But it's $2,000 in 2025, 2026. That'll change to $2,100. But remember, the drug coverage is in stages: the annual deductible, initial coverage, and then the catastrophic coverage. Okay, amount paid for prescription drugs, it depends on the stage. Not all plans have deductibles, and the coverage stage cycle starts over at the beginning of each plan year, usually in January 1st. A fast facts about Part D. You must be enrolled in Medicare A or B or both. Whereas with the Medicare Advantage plan, you have to be enrolled in Medicare Part A and Part B. But with the prescription drugs coverage, you can be enrolled in A or B or both. You may be required to use a pharmacy network, so each plan have their providers, contracted providers. The ones with the contract, they're considered to be in that network. So you may be required to use a pharmacy network, and the coverage costs vary by plan, and it may change each year. Part D premium penalty for late enrollment unless you qualify for a special election period. So sometimes you have individuals that say, well, I don't take any drugs, but that's the way the program is structured, that if you don't have the drug coverage for 63 days, you'll have a Part B premium. Okay. And now we'll go into the Medicare supplement insurance, also known as Medigap. It helps pay for some of the out-of-pocket costs not paid by Medicare Parts A and B. And the Medicare supplement, or the Medigap, it works with original Medicare. So you can't just have a Medicare supplement plan. It only works when original Medicare pay, then that's when the supplement will pay. It works with original Medicare Parts A and B and Medicare Part G. It can't be used to pay for Medicare Advantage costs. So sometimes you have individuals say, well, they have the co-pays with the Medicare Advantage. They have the co-insurance. So sometimes they ask, can they get a supplement to cover those co-pays? They're out of pocket. And the answer is no. It can't be used with the Medicare Advantage plan. With the Medicare supplement or Medigap, there are 10 plans standardized by federal and state law. The plans are labeled by letters. For example, Plan A, Plan G. And what costs and services are covered that varies by plan. Plans with the same letter offer the same basic benefits nationwide. Massachusetts, Minnesota, and Wisconsin standardize plans differently. So plans are offered, all Medicare supplement plans are offered by a private insurance company in the state. Plans may help, the Medicare supplement plan may help pay Part A hospital costs, Part A skilled nursing facility care coinsurance, Part B coinsurance or copays, cost of blood transfusions up to 3 pints, cost for 365 extra hospital days. It could pay for hospital care, hospice care coinsurance. It could help pay for Part B deductible, Part A deductible. It can help pay for foreign travel emergency care up to the plan limits. And then it can help pay for provider charges above Medicare's approved limit. Plans do not help cover prescription drugs. So if you have a supplement and original Medicare, you still need the prescription drug plan. It does not help cover routine dental, vision, or hearing. It does not help cover eyeglasses, contacts, or hearing aids. It does not help cover custodial care, including help bathing, eating, and dressing. And then it does not help cover long-term care. Okay, the standardized Medicare supplement plans, and in different states, they have the different plans. Okay, so every state doesn't have all the standardized plans. So you can kind of start with plan F, you have plan B, plan D, plan G is the popular one now, plan K, plan L, plan E, plan N, plan C, and then you have the plan F. So those are what they call the standardized plans for Medicare supplements or Medigap. And again, the way this works, it pays the 20% that you're responsible for if you're getting your coverage under original Medicare. Fast facts about Medicare supplement insurance or the Medigap plans. You must be enrolled in both Medicare A and Part B and live in the state where the plan is offered. No medical underwriting up to 6 months after enrolling in Part B at age 65 or older. Nationwide coverage and no provider networks. Guaranteed renewable as long as you pay your premium. The plan premiums may vary for same coverage. Plans with more coverage generally have higher premiums, and you must continue to pay the Part B premium when you join a Medicare supplement. So how much does Medicare cost? Okay, the costs associated with Medicare. You have the premium. It's a fixed amount that you pay for coverage, usually monthly. And remember, we said Part A for most individuals is premium free. However, Part B has a standard premium and is slightly higher for individuals with higher income. The deductible is a set amount that you pay for covered services before your plan begins to pay. Then the other cost would be your co-pays. Medicare doesn't pay 100%. So the co-pay is a fixed amount you pay at the time you receive a covered service. Then you may have co-insurance instead of a co-pay. The co-pay is a fixed amount. The co-insurance is an amount you pay when the plan splits the cost of a covered service with you by percentage, such as 80% or 20% co-insurance. Part C, Part D, and Medigap costs. Plan will vary in the cost they choose to include and how much. Costs you could pay may include the Medicare Advantage Part C, low or monthly premiums. You could pay a deductible. You would have the co-pays, and then you could have the co-insurance out-of-pocket costs. With Part D, prescription drug plans, you could have the monthly premium, the deductible. You also would have the co-pays and the co-insurance. And with the Medicare supplement insurance or the Medigap plans, you would have the monthly premium, you could have the deductible, the co-pays, and the co-insurance. So Medicare Advantage plans have an annual out-of-pocket max for Medicare covered services. So how do you choose? Medicare coverage combinations. So if you want to stay with original Medicare and you have that Medicare Parts A and B, which is original Medicare, you may consider you got to have your Part D coverage, your prescription drugs, if you're not a veteran or you don't have any other deemed credible coverage. And then you may want to get a Medicare Part, original Medicare, and add a Medigap plan. But the best coverage for original Medicare would be Part A and B. You would have your original Medicare, add that prescription drug coverage, and then you would also add the Medigap plan to take care of the cost share that you would be responsible for, the 20%. So that's the first option. That's option one again. And you may choose the Medicare Advantage. It depends on if you get Medicare Part C. Remember, that's combined coverage. You can get Part C, and if a certain types of Medicare Advantage plans, just one type called a private fee-for-service, that you can add Part D. But for the most part, with Medicare Advantage, the Part C is included. So that's the second option. Original Medicare, the first one is original Medicare. You add your prescription drug at the Medigap coverage. And then the second is mainly just the Medicare Advantage. Okay, so Medicare coverage choices again. Step one, you enroll in original Medicare. So original Medicare, that's provided by the federal government. Again, that has parts A, helps pay for hospital stays and inpatient care. Then you have the part B that helps pays for the doctor visits and outpatient care. So the first step is to enroll in original Medicare. Step two would be to decide if you need additional coverage. Again, there are two ways to get it. Option one, again, add one or more. You have your original Medicare, you add your prescription drug and your Medigap. And then you have the option two, where you choose the Medicare Part C with combined coverage of your hospital, medical, Part D, and extra benefits. So those are two options, two ways that individuals get their Medicare coverage, Medigap or Medicare Advantage. Things to consider as far as coverage. If you have a Medigap, it pays some costs that's not paid by original Medicare. It does not help with drug costs. It does have nationwide coverage, and it may offer additional value-added services like discounts or things such as that. Whereas the Medicare Advantage, when it comes to coverage, it provides benefits of original Medicare and beyond. It often includes Part D drug coverage. It may have provider networks, and it may offer additional health benefits like dental, vision, and hearing. If you compare the costs with the Medigap plan, there's a monthly plan premium, the drug plan premium, and other costs if you also add a standalone Part D. So you would have your Part B premium, you would have your Medicare supplement premium, and then you would have your drug premium when it comes to costs. And then you would have out-of-pocket costs that depends on the plan that's chosen. Now, the cost of the Medicare Advantage, they may charge a premium, but most Medicare Advantage plans have like the zero premium, but not all. Often, no additional premium for drug coverage, co-pays, or co-insurance for most covered services. And then with that Medicare Advantage, you have that out-of-pocket maximum that caps your expenses that you don't have with original Medicare. But you do have, if you do get that Medicare supplement, then that would pick up the out-of-pocket. Then the second C we want to look at is the convenience. The Medigap, if you choose the original Medicare, a drug plan, and the Medigap, you have multiple plans when added to original Medicare, along with the Part D. So if you choose original Medicare, you're going to have that drug plan, and you may choose to have that Medicare or Medigap plan. But with Medicare Advantage, it's all in one plan, one cost. So when can I enroll? The initial enrollment period is a 7-month period, and that's 3 months of individuals that's turning 65, 3 months before their 65th birthday, a month of their 65th birthday, and then 3 months after the 65th birthday. Medicare Parts A and Part B, you'll be enrolled automatically. So if you're receiving your Social Security or Railroad retirement board benefits at age 65 or after receiving Social Security disability benefits for 24 months. You must enroll yourself. If an individual is not receiving those benefits, then they have to actually enroll or apply for Medicare. And to do that, you go to this ssa.gov/benefits/Medicare to enroll online, or call or visit your local Social Security office. Medicare Advantage, Part C and Part D, you need to enroll directly with the plan providers. That's how you get contacted, and it's best to work with an agent so they can help to explain the benefits of the plans, because all plans, they don't cover the same benefits equally. So it's best to work with an agent when you're doing Medicare Advantage. Here's some tips. Enroll early to avoid gaps in coverage and late enrollment penalties, and may refuse or delay enrollment in Part B with credible employer coverage. So if individuals still working, they can delay enrolling in the Medicare. Then you have the general enrollment period. So if you don't enroll when you're first eligible, when you turn 65, then they have what they call a general enrollment period to enroll in parts A and B. And then for those who missed their initial enrollment period, may enroll in Part B, or both. They may choose to enroll in the Medicare Advantage plan, and the late enrollment premium penalties may apply. But the general enrollment, if you decide to delay enrolling, it's from January through March of each year. Medicare Supplement open enrollment period. Age 65 or older and enrolled in Medicare Parts A and B. So you can't get these other plans like the Medigap or the Medicare Advantage until you get the Medicare. You got to have both parts. Okay, the Medicare Supplement open enrollment period, it lasts for 6 months, beginning with the month in which you were 65 or older and enrolled in both Medicare Parts A and Parts B. No medical underwriting if you enrolled during this time. You may apply at other times, but you could be denied coverage or charged a higher premium based on your health history. Some states may have additional open enrollment rights under state law. So the Medicare Supplement open enrollment period is a 6-month period, and it begins the month that you turn 65, whereas the original Medicare is like 3 months before you turn the month of and 3 months after. Okay, there are also special enrollment periods for individuals working past 65. So the last month of employment or employee health coverage. For those who delay enrollment with credible employer health coverage, you'll have 8 months to enroll in Part A or Part B or both. You will have only the first 2 months to enroll in a Medicare Advantage plan. That's the Part C or the Part D prescription drugs. You have exactly 63 days to get a standalone Part D plan or a Medicare Advantage plan with prescription drug coverage without penalty. So if you don't get your Part D coverage, you would be subject to a late enrollment penalty if you pass 63 days without coverage. And that's a permanent penalty. The late enrollment premium penalties. Okay, for Part A, none if qualified for free. So you don't get penalized if you don't enroll in Medicare Part A and you're qualified for the premium free Part A. But if you don't, the penalty is 10% of the Part A premium. Medicare Part B, none if you qualify for a special enrollment period. However, the penalty is 10% of the monthly Part B premium amount for each full 12-month period. Enrollment is delayed, 10%. And then Medicare Part D. You don't have a premium if you go without coverage for less than 63 days. The penalty if you do go without it for 63 days, there is a penalty in addition of 1% for the coverage of the Part D premium for each month you delay enrollment. And those are permanent premiums. They don't go away. So when can I change my coverage? Medicare annual enrollment period, October 15th through December 7th. So during the annual enrollment period, which we're fastly approaching, you can join, switch, or drop a Medicare Part C or Medicare Part D prescription drug plan. You can switch from original Medicare Parts A and B to Medicare Advantage plan or vice versa. Or you can switch from one Medicare Advantage plan to another. So there's unlimited switching during the October 15th through December 2nd. So the Medicare Advantage open enrollment. So once you enroll in a plan and during the annual enrollment period, that coverage starts on January 1 of 2026 of the next year. It always starts on January 1. But during Medicare Advantage open enrollment period, that also starts on January 1st and runs through March 31st. So during the Medicare Advantage open enrollment period, it's available to Medicare Advantage plan members only. So you have to be enrolled in a Medicare Advantage plan in order to be eligible to participate in the open enrollment, the Medicare Advantage open enrollment. So during that time, you can switch to a different Medicare Advantage plan or return to original Medicare Parts A and B. You can enroll in a standalone Part D prescription plan if returning to original Medicare. And then just one coverage change is allowed. So like during the annual enrollment period, like I say, you could switch as many times as you would like. But with the MA or the Medicare Advantage open enrollment period, you just have one, you're just allowed one change. Then you have the special enrollment periods, and these are based on qualifying life events. And you have you have a qualifying event, and then you have like 2 months after. In most cases, you have 2 full months after the month of the qualifying event, say for instance, like you move or something like that, to make plan changes. During this time, you may join, change, or drop your Medicare Advantage or prescription drug plan outside of the Medicare annual enrollment period without penalty. So common events that may qualify for SEP include moving, leaving retiree union or COBRA coverage. So if you're enrolled in a plan, you move outside of the service area, that plan is going to disenroll. You'll be disenrolled from that plan. So that's why you have that special enrollment period to find another plan in the area, in your service area. So now we want to look at how can I save money? So use benefits wisely. So you want to use preventive services. Use your plan's provider network. Asked about generic and low-tier prescription drugs. You want to use plans preferred pharmacy network or mail order pharmacy. And then understand your status in the hospital. So these are ways that you would use your benefits wisely that can help you stay healthier and save money. There are some programs that offer financial assistance, and those programs include Extra Help. This program helps with Medicare Part D costs. Then you have the Medicaid. It provides health care coverage for people and families with limited incomes. And the programs vary by state. In our state in South Carolina, it's called Medicaid. In other states, it may be, they have a different name. Then you have the Medicare Savings Program. It helps pay Medicare Part A and Part B costs. And then you have the program for of all-inclusive care for the elderly. It's called the PACE program. It provides care services for frail elderly living in the community. And you can call your state SHIP office or visit shiphelp.org. Call 1-800-Medicare, 24 hours a day, 7 days a week to get that number. Okay, so where can I go for help? You have Medicare Made Clear. You can visit MedicareMadeClear.com for more information and resources such as videos, downloadable guides, and more. You can sign up for the newsletter at GC Financial, or you can view your Medicare topics and articles brought to you by Medicare Made Clear. Okay, more resources, visit Medicare.gov. You can call Medicare or your state health insurance assistance programs to get help, or contact your local Social Security or state Medicaid office. Okay, and thank you. The best way to get help is to call Gabriel or GC Financial.
Well, thank you, Ms. Gwen. Thank you again for you being so thorough and really explaining this to you. I know I had several questions about 2-3 years ago when I started working with you just with this, and just made my transition with ACA in the Medicare space. Just been a blessing to me. Just I help people all over the country. You train agents on this space. But thank you again for taking the time to join me today. So, folks, open enrollment is around the corner. Hey, you want to get with an expert? We have the dream team here with my mentor, Ms. Gwen Wright. We're here to help you here at GC Financial, where we build your future one step at a time. So, hey, jump on the calendar. It's coming. We're countdown. So please take a moment to jump on the calendar or give us a call. We're here to review plans for you. Any questions, we're here to help you, okay? Well, thank you again for listening to the call. And here again is Ms. Gwen Wright and Gabriel Timmons here with GC Financial, where we build your future one step at a time. Thank you again for joining us.